name is Kedia. I was born and raised in Kampala, Uganda. I studied my undergraduate studies at Makerere University, where I did an undergraduate degree in economics, and I graduated with honors. With regards to the health sector, out-of-pocket accounts for over 49% of our total health expenditure, and it's caused many Ugandans to experience catastrophic expenditures, while others have been pushed into impoverishment. There's a need to move towards universal health coverage. Given all these explicit economic concerns, the need for health economists in the country has surged. So for me, this opportunity to work with WHO is going to help me broaden my understanding of how to tackle and manage such health challenges that are facing Uganda. Of course, with the view to translate the knowledge that I receive in Geneva to Uganda's specific context.
I'm 26 years old, medical intern here in the Medical University in Tunis, and I'm in my final steps to get my MD degree. I think that one of the biggest challenges for the Tunisian healthcare system is improving the quality of services, especially in the public sector, and I hope I will be part of the team who will be doing the assessment and the evaluation of the healthcare structures, the outcomes. What I want to gain from the WHO internship first is a strong understanding of the internal process and the internal work of an international organization. Secondly, also all these technical and procedures to form and to develop international health policies. After the WHO internship, I see myself more effective here in the country because I know a little bit the system, and most important, I know the culture and the human resources here.
I've just arrived here at WHO. I feel very excited and anxious at the same time, but most importantly, I feel proud. I've always wanted to work at this place, so this is a dream come true for me. Hi everyone, I'm Kedia.
And I'm Yassine.
This is our day one at work. We just got our badges. Day one is going good so far. We are planning to go and meet our supervisors.
So let's this long 3-month journey begin.
So my name is Gianluca Burci. I'm currently an adjunct professor of international law here at the Graduate Institute of International and Development Studies. But I worked in WHO for 17 years. Internships, as you know, are opportunities for students to spend some time with us and see from inside how WHO works and to contribute to WHO, because many of them are bright people with great research skills and so on.
You know, there's been a real evolution in the quality of the candidates that we get. And I would say, very roughly speaking, the generation that you could call the millennials are hands down more clued in, more energetic, more well qualified, and they bring more skills and talents to the organization than certainly I would have ever done at that age, and much more so than, say, 10 or 15 years ago. I would say these kind of opportunities are essential because you need to develop intellectual capital, which is knowledge and skills and competencies and experiences. And it's like a toolbox. You carry that toolbox with you for the rest of your life.
For the young professionals, it's still a little bit stilted. In other words, the young professionals who come in, they come in because someone knows them, and that tends to be a person of their country of origin. And so there is not a very deep-rooted process whereby the diversity among young professionals is pursued.
The distribution in a way shows, if you want, the systemic problems that an organization so decentralized like WHO faces in distributing the interns around the world.
This is an international organization, and geographical representation and different viewpoints is a part of what we should be exemplifying.
The barrier is principally financing. Geneva, or also we have internships in other offices of WHO, they are relatively expensive. Geneva certainly is. So people, those who can come at their own expense are those from fairly well-off families.
I sort of consciously reached out to professors I know in African universities, in Uganda, in Kenya, in South Africa, in Senegal, in Morocco. But all said, if you don't give financial support, our students, most of our students, cannot afford it.
South Africa would like to thank the Secretariat for the report, and we want to focus only on the internship program. The WHO internship program, Chairperson, was established in line with the broad understanding of the United Nations that internships are unpaid. It is important that as we address this issue, we look at alternative ways of supporting these interns, something along the line of financial support to at least the least developing countries, mainly around travel and subsistence allowance.
I thank you, Mr. President. The Chinese delegation thanks the Secretariat for its annual report. We hope that WHO offer internship in headquarters and regional and country offices to brilliant students and young professionals selected by member states and recruit the best of them. I thank you, Mr. President.
Internship, you have very rightly mentioned the fact that it was a very good entry gate for qualified young professionals. If you were willing to provide some subsidies to interns, we would be very grateful, but we need the funding for that.
So basically, one of the strongest take-home messages for me is like improving public health, improving the health system. It's really about institution and it's really about governance and leadership. But like this will not happen if we don't have a school of public health. And this will not happen if an internship at WHO in Geneva costs like 10,000 euro. And this will not happen if the political will to improve the skills and to build the capacity of young doctors and young health professionals to deal with public health issues is not there.
My experience at the internship was nothing short of a professional dream coming true for me. I was both honored and privileged to work alongside the most recognized names in my field. So for me, that was really exciting. In terms of the work itself, it was both intellectually rewarding but also challenging. The most outstanding thing for me was that I was able to link a very narrow purview of public health issues, which is what I was exposed to before that were country specific, to an overly broad purview of global health challenges. So for me, this was a very big gap in my previous work experience that the internship was able to fill for me.
If I could talk about the program that has brought Christabel to work with us, that has been an amazing opportunity for not only her, and she's extremely highly qualified, but also for us.
Most importantly, it gave me friends in all parts of the world. So now I have German friends, I have American friends, I have Iranian friends, I have a Tunisian good friend, I have friends all over the world, and I couldn't have, got all these friends without participating in this global health internship.
When I look at the quality of the candidates that come and what they're bringing and the skills that they have, I'm also thinking, well, the future isn't so dark, There's really a lot to be hopeful about.